Today we're going to go through a journey which we have. This is a diabetes series to the DSMES and the behaviors identified by the ADC. Those are the 7 behaviors of the diabetes. How many of you have heard before the services? How many of you have heard about it? Do you want the emojis? Can you show me with your emojis if you know what the services are, the DSMS and the 7 behaviors? I see some of them. Very good. Well, that gives me an idea that we're not like in a unknown territory for most of you. So our objective today is focus so we can understand, what are the service of the DSMS and the 7 behaviors, because we're going to provide information that will help us to focus in how important these 2 aspects are and how to promote centralized attention with a person with diabetes. Also, we're going to be what techniques and strategies we can utilize to for people to be involved and that compromise in their, which is just improving the health results. If we had known that evidence say that those people with diabetes, nonetheless, of the issue that they have are receiving their services of DSMS and known before about services and diabetes education, those people, they have better results, better health results. They have better lives. They avoid complications associated with the illness. Nonetheless, we know that they're barely use the services. We also know that most of the programs, they don't focus on that reference that are the 7 behaviors. So in Mexico, they call it the 7 jewels of the diabetes care. So we're going to talk about the wellness. So we're going to focus on that it's that is taking care of the mental health and the health. It's November 14 was the Worldwide Day of Diabetes, and we call it like the Blue Month. And this year, the federation, the national federation, international federation, that they're the ones that promote the Diabetes Day. Well, it's the main thing is promote health, mental health and emotional health. So a little bit of epidemiology. Well, it's that 38 million of people in the United States that have diabetes. That's 11.6%, and 98 millions of people in the United States, they have prediabetes. The tragedy is that 1 of every 5 could have it, and they don't know it. So it's there where we have like a huge job in those people that have the condition. But also, if you see that iceberg, those are the 98 million people in the United States that have prediabetes, and the majority of them, they could have it and they don't know about it, which the results are that if you don't know it and don't take action, then the prevalence goes up, of course, in diabetes type 2. So diabetes is a situation that it's really, really important emergent situation. So now we're going to see like education and care about diabetes. The importance of managing in the clinics. Why is it important? Because of what we were saying before, it's a high index of diabetes. It's a really important illness with millions of people affected in the United States. And this clinics, healthy, that normally seek, the people with high index of diabetes, which, how you handle it, it's crucial. So who are here in the centers? Who are they? So low-income people that live in rural areas, people that come from families that work in like agriculture. They're people that we call them vulnerable population, where diabetes is high, mostly in the Latin or the Hispanic population. So we want that it's like a holistic, where the centers, the health centers, can provide like integrative services and also medical attention, nutritional and mental, and also mental health. It's a very, very abandoned aspect, because the majority of the care and diabetes, it's just visualizing the clinical index, like the A1C, like the blood pressure, like the weight, like the timing, the population type 1. And we're just looking at numbers like index, but the people that lives with diabetes, it's more than that. And the emotional aspect, it plays a really, really important role in it. The evidence shows that the people that have like a very effective like support system, they yeah, it's shown that they could have a better health. So people that have a support in mental health also have opportunities to have better results, better health results. Also, it should be like a teamwork, focus. Just watch out how I'm describing the team right here, because normally we hear the word interdisciplinary, multidisciplinary, but now the evidence, it's moving, like focusing on transdisciplinary teams. Why? Because this allows more coordinated attention, and it covers all the health aspects, even lifestyle changes, and how take care of the medication. So when we refer to transdisciplinary, what are we referring to? This means that we're going to have a diverse team. So of course, it's going to be a doctor that is always like the head of the healthcare, and that doctor can be a PCP or PCP or general doctor, endocrinologist. It could be cardiologist. It could be internal medicine doctor. It could be an assistant physician or a nurse practitioner. In most of the cases, we see that some of them is the one that is in charge of the boat. He's in charge of the boat. And in that focus, we have the role that plays the nutritionist or the dietitian, the role that the educational, the health educational plays, nurse, and the podiatrist, the role that the ophthalmologist, and we could, adding each one of the specialties. When we focus on the transdisciplinaries, is that we take every area from their perspective, and all of them analyze each case in particular from the point of view, an individual point of view, and population. So if we take like the Agua Prieta Center, and we see that this center has registered 400 people with diabetes. What index are they using, that center is using, to follow this person from the point of view, the medical point of view, and what services of DSMES is he receiving, and what are they focusing on those 7 behaviors, and how each member of the team from the back is going to manage that patient, but it's going to share with the rest of the healthcare team. The nutritionist, what is, nutrition, the nursery, maybe insulin techniques or how to administer insulin, the pathologist, maybe checking the feet, the ophthalmologist checking what's going on with the eyes, the cardiologist is checking what's going on with the blood pressure, the nephrologist is checking maybe if they're leaking proteins, or, well, we see that each one of them plays a very important role. And you can't miss, the perspective that that transdisciplinary focus, the communities of the healthcare promoters play a real vital role because they're the bridge between the community and the services, the health services. Also, that the access is very important because it's very important that we improve the accessibility and the affordability. What's the difference between those? I can have access to this glass with water because I have it, but maybe it's not very affordable because I can pay the price. So it's not that only the services are accessible, but also affordable. So we can satisfy their needs, particularly in population, those unattended population, or those that are facing barriers in the treatment. We know that, in diabetes, they're inequalities. So like technology, we know that a glucose monitor and an insulin pump makes a huge difference, particularly in the population with diabetes type 1. But every population, so the people with diabetes type 1, they have access to a monitor and a pump, insulin pump. Do we see the population with type 2? Will they all have access to intelligent pens? Well, we see that in this, there's issues of affordability. Also, we need to check that these services are accessible, that we reduce the financial barriers, and to offer them, to empower them, that the people that lives with the diabetes, for them to be take possession of their illness, and to make the best they can to maintain that glucose in range most of the time, because we know that those people that maintain between 80 and 90%, that they maintain the glucose in the range according to the date and other factors. Those people, so what they do is that, they, okay, so what tools are they using? For those that live with diabetes, can develop those lifestyles, healthy lifestyles, that, they go hand in hand to those 7 behaviors. Good. So now, what is the role of the healthcare professional supporting patients? I will tell you that the first is the patient education. The education is the most thing we can do to someone with diabetes, so they could have like a autocontrol, like an effective autocontrol, self-management, that they can make decisions informing minute by minute, day by day, 365 days of the year, because the people that live with diabetes, we don't live in the center, and I can take my nutritionist with me if I go to a Chinese buffet and have dinner. So what are my best choices? So education. In diabetes, it's a vital point, the role in all professionals, and that interdisciplinary empowerment, showing patients that they take like an active role in their own attention, giving them the ability, the knowledge, the strategies, and the resources that are necessary for a self-managed, effective evaluation. So we do a lot. We do so having assessments, it allows us to see the whole view. So to determine what are the preferences, but also the challenges. Do we know that this person that we're giving them maybe a workshop about healthy eating, maybe do they have like security? Has this patient has been missing 3 appointments? We say maybe he doesn't care. Maybe he has transportation issues. What other what are the things interfere in that the person can have a well care management and access all the services of care and education. That's why the assessment plays a very important role. And how do we personalize those strategies? How do we develop those care plans that have been individualized and that address the lifestyle, the changes, the medication management, and other health concerns that play a very important role? And the access that people that live with diabetes. So we know also that the role of healthcare professional, it has to include all the people there. Did it include pharmacists? Because now you're talking about the inclusion of the pharmaceutical. So it's part of the service of the DSMS. Technology, it's a very important role. There's so many apps now. There's so many technological resources that help people with diabetes, and there's some that are free of cost. I also do the PayPal because my paw is an application that allows me to follow everything I eat, my activity level, and with people with diabetes, physical activity and food, they play a huge role, so important. They have a direct influence and that timing. And sometimes we don't take the opportunity to explore it. What technology is free of cost, which ones are available that will help my patients, that will help people with diabetes to have like a better, to make it easier to monitor and to have more stable goals. So it goes more than insulin pumps or glucose monitors. There's some application that can make a huge change in people that live with diabetes. So it requires training, patient, and hard, and the options of telemedicine are still a huge support, and like in people that they're not being attended. So now we're going to understand the services of DSMS. So I'm going to ask you, if you had to explain, what are the SMS services to your neighbor, your mom, your uncle, your aunt? How would you do it? How would you describe those services to them? How would you describe the services? I would like to someone, I can't see the screen, so I need a little bit of help. So I would like at least one person open the microphone and share with us. How will you explain your aunt, your neighbor, your grandmother? What are the services, the educational services, the DSMS services? Okay, who's the brave one that tells us in their own words? How would you explain this services to a neighbor, mother, uncle, grandmother? How will you do it? What will you tell her or tell them? And you can put it on the chat if you don't want to unmute. I, I, I think it's autocontrol. It's empower people. Autocontrol, empowering people. Yes. Can you see some of the comments in the chat? No, they just wrote down, well, now it's education for, to manage, to auto management, workshops, educational workshops for the auto management of diabetes. Good. Well, because of time issues, I'm going to continue. Well, the idea, the main idea when we talk about DSMS is that they're chats or workshops or it's educational only. So if you today can take like a more broad idea of the services, because this is more than a workshop, it's more than chatting. It's more than covering a curriculum. It has more comprehension. As a matter of fact, we in CDC, we invested 3 years of investigation, formal investigation with people with diabetes, the SMS and supporters and nurse practitioners, providers, with a number of health providers. And what did we find? What did we found? There's like a soup of alphabets out there. So how are this? What's the name of the services? Before it was like diabetes education. Now it's the DSMES. So in order to make this more interesting, Medicare adds a T at the end, training, and people, even the ones that provide the services, the ones that pay for the services, that they receive the services, all had what my mom will call, so it was like a spaghetti plate in their head. It was everything scrambled. So now that the national standard for the DSMS services, they offer a definition. The definition was in a language not easy, not simple. So it wouldn't let unify what is it that we call DSMS services. And I will share with you what we know. And I will tell you, so what are the services? We know that the services help people manage their diabetes in ways that fit their lifestyle, can be offered in healthcare or community-based settings, maybe only or in person, individual, online, or it could be individual or in group. It can improve health behaviors and outcomes, but is underused. And also we know that one size doesn't fit everybody. So this is what we know about DSMS. But is this DSMS? I have news for you. No, it's nothing about this. When we did that survey, more than 500 people with diabetes, this is what they told us. It says, whether you are new to having diabetes or have had it for years, when you receive diabetes, why did you make this difference? Because all the people that were interviewed, they describe living with diabetes like a journey. And so I can be initiating my journey. I can be, they just diagnose me, or I can be living my journey like my daughter that's been 42 years living with diabetes. I've been 30 living with diabetes. And then either something new without with a diagnostic, or that it's or maybe you've been living 20, 30, 40 years with it. When you receive the services, what's going to happen there? Are you going to be working? You're going to be working with a specialist. And so you're going to be working with a specialist before known as diabetes educational. Now it's a specialist in diabetes care, because it's more than giving a class, more than a workshop. So what's going to happen at the beginning with that specialist? You're going to establish goals, and those goals, you're going to follow up with those goals. And those goals are measurable, reachable. So now I'm going to add, so to be inclusive and consider equity, because of the determinants of the healthcare. So whose goals are those? That was another important conversation with these people. So they're not my goals as a specialist. The goals are from the person. What the person needs to reach their goal, to have like a good management, like an effective management. So people with this services, they learn how to apply the knowledge, but also the skills, but also the tools. Identify the tools for what? To have more confidence, to have more strength. Primarily, have more strength to manage your diabetes, and then practice how to incorporate the diabetes healthcare in all your daily routines. For example, when you eat, or how to resolve issues. For example, this morning, I had a situation a little bit uncomfortable for me because I didn't remember if I had administered my insulin or not. That was a huge issue. I don't have a pump that will tell me how many insulin I have active, or I don't use like a pen. I use just like a normal syringe because there's two people with diabetes and resources are for my daughter. She has a pump. She has the glucose monitor. I just have my syringes and my Lantus and my Novolog, right? So what a huge issue. So what did I had to do? I had to monitor my glucose levels until finally I noticed that I hadn't injected myself. So then I could inject myself and I could continue, monitor the rest of my day. I'm here, coherent, giving this chat with you because that's what it is about. How to incorporate, the diabetes care in all your routines. Because we people that live with diabetes, we have other things. Maybe a 68-year-old woman, we have maybe recent memory issues. So you see, it's complicated living with diabetes. So how can we solve the problems? And finally, find, ways to get support in person and online from who? Your family, friends, community, and healthcare team. If you don't remember anything about what I have talked about today, and when you explain DSMS, you use this definition, this simple definition, I would have complied with my mission. So now, why don't you move? Let's see here. It doesn't want to move. Okay, here we are. Okay, here. I wanted to share with you a great Rosalina Mateo. She's a great friend of mine. She explained this in a way that it's so beautiful that I thought it was important to share with you. So she says, imagine you're trying to take care of a garden. You need to know what plants to water, when to water them, and how to handle pests. Diabetes self-management education and support, or DSMES, is a bit like that for managing diabetes. It's a set of services that help people with diabetes learn how to take care of their health. These services teach you about things like how to check your blood sugar, the best way to eat to keep your blood sugar stable, and how to stay active. They also help you manage any problems or questions you might have. Just like a gardening expert would guide you on how to take care of your garden, the DSMS provides guidance and support so you can better manage your diabetes and improve your quality of life. Oh, that's a lot of knowledge, what a nice way to explain it from a health promoter. I thought it was beautiful. Look, now, in that focus of DSMS, we can see the healthy behaviors, the ADCES7. So in the middle, who is the person that lives with diabetes. So the first behavior, what is it? So it's problem solving. Because when I have a good relationship with my diabetes, then I'm able to have a better management of my medication, my food, being physically active. And I keep on expanding, in order to monitor my glucose. And I have those skills to how to solve problems. And I practice those things that reduce risk, like stop smoking, like my vaccines, immunization, my checkups, my mouth checkup, my feed every day, my blood pressure in every visit, my kidney function, all those checkups that a person with diabetes we have to do, those are going to be reducing risks. But problem solving, it's a situation like I had this morning that I didn't remember if I had given, my insulin shot, and what should I do? And then how to eat, how to be physically active, how to eat. But the center, the model, it's the person with diabetes. Then what is needed? Well, the person with diabetes needs healthy eating. Now we have to discuss the importance of nutrition. And it's not one thing like what can you eat or what can she eat, because there's nothing like a diabetes diet. If everybody ate like the people with diabetes eat, there would be less obesity, less triglyceride, less cholesterol, less blood pressure, because a healthy nutrition is the incorporation, of everything. It's avoid processed foods. It's avoid, fats, saturated fats and sugars. So active is really good for people with diabetes, but it's good for everybody. The general rules say 30 minutes of physical activity every day, or 150 minutes a week. And that could be go walk. And if you don't like walk, dance, but move, you need to move. So monitor. So it talks about self-monitoring of blood glucose. It's not just monitoring. First, having the monitor, then having like the habit of checking, and then know what to do with that, and then document that. If I don't have like a monitor, glucose monitor, and then know what to do with those numbers, and then know how to incorporate those numbers with the amount of food I'm eating, with the physical activity. I have fever, I'm throwing up, what can I do? Well, taking medication. Discuss management of prescribed treatments. It's not just insulin, because people with diabetes also maybe have like an ACE inhibitor, maybe blood pressure pill, or maybe they have gastric issues and they need omeprazole. Tell me, and I will name and associate illness with diabetes. It's more than medication. It's those illnesses that live in the same bed that diabetes is. So the how to promote that proactivity and reducing the risks and healthy coping, that is this, address emotional mental health support that is so important. So I'm going to give you, okay, here is a summary. What are the benefits of the 7 behaviors? Leads to effective self-management through improved behavior, guides you to deliver effective person-centered collaboration and goal setting, provides an evidence-based model of assessment, intervention, and evaluation. Encourages a strength-based approach and acknowledgement of the whole person in context of their lives and relations, provides standard vocabularies for assessing and identifying challenges, setting goals, solving problems, documenting issues, evaluating success, and making improvements over time. Throw in 3 words, please. Can you describe your experience with the services and what is the most common barrier you encounter in this area? So now, Maria or Vanessa, please, can you help me with the chat and see if someone is writing something? Okay, yes, we're on the look. Just write 3 words that describe your experience with the services. I have the first word, Maria. Not yet. Yeah, they're a bit shy. Yeah, they're shy. What's going on? Come on, it's not a test. Okay, I'll help you out. Sometimes I've heard frustrating for the person that is receiving, so the person, because they say, this is something that I can't do, live with diabetes, it's so difficult, frustrating for the person that offer it, because I'm trying to teach her when she comes and she comes back with that, I don't know, 8.4, or look, she had 8.4 and now she's got 14. My God, what am I going to do with this person? Or look, they had like a nail, now so now the toe is purple. They didn't do anything. So it's a frustration in the system and the person and the provider, but also not necessarily has to be negative or black. I've also seen successful stories. A person that, came, didn't know anything. We give them the information, they develop all the skills, the abilities, and then There was a boy referred to me with Down syndrome, and the mom says, Betsy, I'm a single mom, and I'm worried about, if something happens to me, he doesn't know how to do anything, and he has diabetes type 1. And I told her, okay, first of all people have the capability of learning something. Well, to make the long story short, I've been intervening with Jaime. She's been, working with me for 8 months. Jaime has a syndrome, the Down syndrome, severe, a little severe, but Jaime has learned to check his sugar by himself. He knows when it's low, he knows when it's high, and he knows how to notify mom that he needs something to eat. So then, either this person in particular that has like a disability, like a condition like Down syndrome, we could work with him. We could work with the mom so that he could develop like a better relationship with her son's diabetes, and identify the potential and the capability that Jaime could do things by himself. So we went up, so his self-esteem went up. His the mom's well-being went up. And so now we have 2 people living with diabetes from different points of view. So for me, that's a that's a successful story. So the stories, that something in the process was lost. Maybe those social determinants on health, maybe that assessment or pre-eval that we do that maybe it doesn't went well, or maybe that clinical focus. People that have diabetes, we're more than a number. We're people first. Then diabetes doesn't define us. But yes, it could impede us do what we would like to do if we don't have someone that walks next to us and gives me the knowledge, the skills, the abilities. So these services help to free those barriers, in the access. It helps incorporate that cultural competency that is important, because sometimes people come to me and say, so Betsy, so I have to stop eating my pupusas? No, you can eat your pupusas, but you can't eat 10 pupusas. Or if you're Puerto Rican, I can't eat tostones. Yes, of course, but you can't eat 20 tostones, my darling, just, or the Mexican, they don't count the tortilla, they just roll them and they eat 10 tortillas at once. Well, we need to observe their behavior. You can eat your tortillas, you can eat your tostones. So we see how the cultural competency is there, with the commitment, the motivation, that consciousness, that education that is necessary. There's barriers like difficulties, to going to the medical appointments. There's a lot of studies that show that the first barrier, it's, just transportation issues. And sometimes Mexican moms that have more kids, it's how to take care of the other kids, lack of transportation, difficulty with the schedule, work, without benefits, or, jobs without benefits, competing demands such as caregiving for other family members. So each one of them has a solution. So, the barriers to monitoring the cost, personal, financial, individual barriers, age, visual disabilities, and we could continue adding. So which barriers do you think are most significant? And I'm going to jump on the response because you're shy and you don't talk to me. So which barrier do you think that are most important? I would like about you. Are you a doctor? Are you a nurse, dietitian, social worker, a community health worker? Or how can you help, with this? We could, talk, long, but I think the barriers, you're the ones, we're the ones, we're part of those healthcare teams. We need to change the paradigm. We have to create a medicine center in that person. So patient-centered care. So what is that? it's patient-centered care is approach to healthcare that prioritizes the preference, needs, and values of patient, emphasizes the partnership between patients and health care providers to ensure that care is tailored to the individual, promoting the health outcomes and satisfaction, that, that they're centering solutions that enhance health outcomes. So when you do medicine center, we hear, we support more emotionally, we share more information, we have a more holistic focus, we have an attention, integrity, we're more flexible. Look what happens, so beautiful what happens when the medicine is centered in the patient. What are the most important aspects? If you had to select one, you don't have to think about, you just have to choose one. Choose one and put it on the chat. What's the most important aspect of patient-centered and transdisciplinary care for you? Okay, is respecting patient preference, A? Providing emotional support, B? Sharing information effectively, C? It's collaborating with other professionals, D? Or addressing holistic needs, E? Okay, what do you see, Maria? Okay, just check if now they're... Okay, we're seeing A and E. A and E, very good. The truth, there's no one better than the other because all of them are important, right? It's important to collaborate, to share, to provide support, respecting patient preferences, and addressing holistic needs. So, what strategies can we incorporate to engage people? First of all, personal education, the group, but it has to be, with a personalized education. Set goals. People has to know what is expected from them, that know that this week I'm going to be working because I was working with Maria Bustamante, and I agreed with her that I'm going to drink more water, and that's going to be measured, that I'm going to be drinking 64 ounces every day for the next 3 weeks until I see Maria again. People, they have to have goals, concrete goals. Yeah, that the interviews are motivational. If you're teaching a very boring class, blah, 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 well, for sure, they're going to come to your first class and they're not going to return because they don't see the benefit, because it's not motivating, because you don't engage them, because the support groups, it's better to get people together so they can talk about their things. No one that lives with diabetes can understand better what diabetes means or what it means living with diabetes. It's not the same to be a doctor or nurse that living with diabetes. When you live with diabetes and talk about it with other people that have diabetes, there's like a magic thing going on, and that's like a strategy based on the evidence, the support groups, using technology, the following up, and the resources that are culturally relevant. I remember the first time that I went to a dietitian, they talk about my snacks. They said, peanut butter jelly sandwich. And my expression was, excuse me, if someone likes it, guacala, I don't like it. Those things on a bread, it's not something that Puerto Ricans eat. We don't eat peanut butter sandwich. It's not part of my culture. So when you give me an example, then I go home and I don't know what I'm going to do because it's not something that I like. So it has to be cultural resources that they're relevant, that keep that relationship. Yes, this is something that I can do. It's part of my culture. No one takes my beans away from me. They have told me that chicharrón is not the best one, or chorizo is not the best one. But that doesn't mean that I won't be able to eat a piece of chicharrón, in my whole life, or maybe a piece of my or maybe eggs with chorizo in the morning. I can do it every day because it has a huge impact on my cholesterol, you see? So it's a negotiation, a constant negotiation. That's another improvement. Those small negotiations that we do with the person that live with diabetes. So what strategies have you found most effective to engage people with diabetes in your practice? Well, the ones that I just told are the ones that I use, but also the ones that I found as evidence. The scientific evidence say that if you do those things that I just mentioned, engaging people in services is more effective. So how can we improve our current practices? What barriers do we face in engaging patients? How can we better support emotional health? Those are questions that we have to be asking to ourselves constantly. Here are some strategies for patient engagement for the ADCES. Like you can organize like organizing, exercising, maybe teaching about applications, or maybe like how to manage your medication, maybe discussions, how to, create facilitate guided discussions to brainstorm solutions, or, offer regular health screening to identify and at-risk factors, create support groups, focus on emotional well-being and coping strategies, or maybe cooking lessons, with people. You can have workshops. You can incorporate sessions and waiting lists. Well, implement, you can have like health providers, to get that. You can include other professionals, particular like this days that I was in Mexico, and diabetes, he shared with us the change in behavior happens when three things happen: motivation, capacity, and the resources. Three elements that have to happen in order for me to modify my behavior. And that's a model that I learned from a psychologist in order to incorporate it in my sessions with my patients. Art therapy, it's amazing. Put people to draw how they see their diabetes, and you can learn a lot about their emotional aspect. Community gardens, organizing, workshops that incorporate, physical activities. There's some dancing therapy. It's amazing. How can we adopt them? How can we implement those strategies that, they're seeking for the holistic well-being? So this is called So You Can Adopt holistic, but also physical. It's an invitation so you can collaborate and make innovation, to find creative solutions, to involve patients, and to follow up so we can implement a better strategy, about today's discussion and next month. So now I ask you, what's the key insight from today's presentation and will most enhance holistic well-being in our diabetes care? I want to share some of the resources we've got in CVC. We've created this series of videos that we have created. It's called Kickstart, that it's a good start. So these are these are animated videos. It came out from the heart of a group of promoters, and so we developed those 7 videos that are in English and Spanish, and I'm offering that to you. We also have the DSMES, the Healthy Literacy Tool, and it has a lot of resources, and it has my check-in. It's basically before you start to offer the services, you sit down and analyze yourself and relation and what are you going to do to evaluate if your patient has alphabet issues. And also it's the key tools for educators and diabetes educators and healthcare promoters. So they have New Beginnings. This is a discussion of how to live well in diabetes. It's a discussion guide for living well with diabetes. It's in English, but it's in we're going to try to do it in Spanish. And then, you know, in the pathway to a good health, we have videos and podcasts and yes, a variety of resources that we have available that we're offering. And I'm offering those that are available for you. These are the references. If you want to, if you have other questions, there's my email. I have finished my presentation today. I don't know how much time left I have. Megan, Maria, Vanessa, you let me know. I'm here to answer questions.